So welcome everyone to this week's video where I've got 3 clinical practice educators who are going to be talking about their role and how they became a nurse educator. This video topic's been requested by lots of students and newly registered nurses, and my guests have kindly offered to give you some key tips such as the qualifications and professional experiences that help their career development. We should point out that different employers sometimes have different job titles. So it might be called practice development nurse, for example. We don't have national standardisation on job titles, but the roles will be similar, and a lot of the advice for any clinical nurse educator role will be very helpful. So first of all, thank you to all of you for offering to do this video in your own time.
Thank you for having us.
So welcome to Nana Kesse, Pratima Gurung and Maggie Leotta.
Thank you.
Welcome.
Thank you.
So I thought I'd start with each of you giving a concise summary of your career to date. So where you've worked, first of all, and what led you to become a clinical practice educator. And I'm going to start with Maggie because you were saying you're sort of the most experienced out of all 3 of you. So I'll start with Maggie first.
So I've joined the register in 2015, but only came to work in the UK in 2016. And my very first experience was in a urology ward in the north of the country. I've been there and worked there as a registered nurse for 1 year and a half, and then I moved to another trust in the south of England, where I have been a registered nurse for another year in a specialist surgical ward, and then I became the associate clinical practice educator for the education team that was in the same ward, so still specialist surgery. And then after that, I became the clinical practice educator, so main duty as an educator, band 6 for 4 years. After that, I had a couple of opportunities for secondment. So I've seconded my own line manager in the practice development and education lead role for 3 months, as well as the dream sequin lead for the entire division. So more or less I've been here, I think, for 7 years now.
Amazing. So before I move on to another person, do you want to just say what a secondment is, just very briefly for anybody out there? Because that's an amazing opportunity to get a secondment as an educator as well.
Yes, so basically for secondment is like a fixed term contract where I was covering, obviously my line manager was covering someone else for 3 months. So at the end of the 3 months, I went back to my former role as clinical practice educator. I'm still in due course of the dream sequence secondment, as we don't know whether there's going to be funding or not, but it depends on the project essentially. So that was 1 year fixed term contract.
Brilliant. Thank you, Maggie. So I'm going to go to Kesse next because you're next on my screen. I'm just going to spotlight you, Nana.
That's
So
fine.
spotlight Nana. Hopefully you're spotlighted. I'm
Yeah,
not very
hopefully.
good with IT. We're probably going to be all getting bigger and smaller, but the
Let's
information's going to be good.
let's
So
hope so.
yeah, Nana, do you want to give your perspective?
Yeah, so I joined the register in England in 2019. I'm originally from Ghana. I trained in Ghana. So I trained from 2011 to 2015. And then I joined the register in 2016 in Ghana. Then in 2019, I moved to England where I worked in the north of England. So I worked there for about 3 years as a staff nurse. I was on a geriatric ward, which I loved. It was very much enjoyable. And out of that, experiences and growth, I moved to the south of England, where I landed in the role of a clinical practice educator. And I've been doing this for about 20 months now. So I'm pretty much still new in this, trying to find my feet, but I'm really enjoying it. Yeah.
Brilliant. Thank you. So I'm just going to do the same now for Pratima, and I'm going to spotlight you and then going to reduce Nana's. Okay, so Pratima.
So, hello, my name is Pratima Gurung. I have been in England for almost 13 years now. I came first not to be a nurse. I wanted to be a scientist, and so I was studying in Nottingham University in microbiology. That was in 2010, and then I was trying to be a scientist, but I was doing other kind of jobs, trivial jobs. And then in 2015, I came south of England, and then I um, I started working as a CSW, healthcare assistant in a renal ward, and then and after that, while I was trying to also get into scientist role, and then I found out that I could study MSc in nursing, which was provided by England, and the nursing was free in England at that time, so which is why I joined MSc nursing. And then I became a nurse and in 2020. And then I was practicing in one of the wards in plastic surgery ward. And then after 1.5 years, I got into education, and then I became a clinical practice educator, and I have been liking my job until now.
Amazing. So I'm going to ask each of you, but Pratima, can you just sort of concisely say why you chose to be a nurse educator? What led you down that path? And I'll ask Nana and Maggie as well. What made you go into education as opposed to sort of leadership or specialist nurse role?
I mean, education, because I found out that by providing education, you are indirectly helping your patient get the best care. So that is why I wanted to get into education. So yeah.
Lovely, perfect, and a really good reason too. So I'm going to go to Nana now, and Nana, if you with the same question, what led you to go into education?
Well, for
Nurse
me,
education.
as an international nurse, when I came to England in 2019, it was challenging. Had to get used to a new environment, the weather, the food, missing family and friends. So it was a challenging moment. And the I didn't even know they were education team. I thought they were nurses helping us to pass our OSCE. I didn't even know there was something like education team. So they did a really good job. But when I got to the ward, I realized that kind of support wasn't on the ward. So I felt the gap. And I had to find ways to survive. There were people there to support. Then I took it upon myself to support other international nurses, other student nurses, and people coming on placement who were on the ward. And whilst doing that, I kind of enjoyed it. And I realized that, you know what, this is something I would want to do. Then one time, my then manager mentioned to me, would you want to go into education? I'm like, oh, maybe I would want to. So I started looking into that. And when I needed to move on to the next thing, growth and development, I thought, you know, there's something I've enjoyed. In my role as a staff nurse, I was enjoying doing it. And I think I would want to do it full time. And that has been my motivation.
Amazing. So what you're saying is putting yourself out there, saying to people you're enjoying education and linking with the educators because you were starting to educate in your role as a staff nurse. Is that what you're sort of suggesting?
Yeah, so in my role as a staff
Yeah.
nurse, I was doing it, supporting new starters, students, and I enjoyed it. And I realized that this is actually something. Then I didn't know you can have a role in that. So when my manager mentioned, I started looking into it. I was like, oh yeah, I would want to do this. Then that became something I'm doing now and enjoying.
That's really interesting. And also, do you in your home country, do you have clinical educator roles on ward areas? Is it a similar? Is it similar? Because you were sort of saying you didn't
Yeah.
realise you had them.
Yeah. So in my training, when we are going on placement, we had the education team, and we
Yeah.
also had, so as you have the link lecturers coming here to help to see how students are faring on their placement, we had that. But when we went onto the ward, that wasn't there.
Wow.
Yeah.
It's
So
really interesting seeing the
it
difference
is.
globally, isn't it?
It is. So, but things have changed now. Now they've realized that not only do you need to support the students in their learning, but even when they come onto the ward. So they started
Yeah.
also emulating that culture of having educators on the ward. And I think as time goes on, we will tend to have a lot more, but
Yeah.
it's just sipping in gradually.
Yeah, yeah,
Yeah.
brilliant. So thank you, Nana. So I'm going to go to Maggie. I'm going to spotlight you, Maggie. So same question, what led you to go into education, clinical nurse education?
For me, it was a bit of a different experience, but similar to Nana, because in Italy we don't have educators on the world. Obviously, you do your theory part at university, and then when it comes to placement, it's that you have nurses to follow, and most of the nurses don't even have a supervisor or assessor course, so they don't really know what they're doing. And I had such a horrible experience as a student. I wasn't treated very well by the nurses because I didn't know where the things were. Obviously, I was thrown in the deep end, like, there you go. And I was supposed to find my own feet, around the world that I'd never seen before. And I was like, okay, this is something that is never going to happen if I have a student. And then I experienced the opposite in another ward when I was in Italy still. And I had the best mentor I could ever ask for. And he was explaining me everything. He was squeezing me, assessing me all the time. And I learned so much. And then I realized actually this is what I want to do. I want to make a difference in a student life and make it worth it. If they want to be nurses, there must be a reason why they're nurses. And we don't have to keep that reason and motivation alive, not to like
Yeah.
just put it out with water and whatever. So when I came to England and I actually met my educator at the time, I was looking up at him and admiring him, and I was like, wow, I want to become like that one day. I didn't even know that that was actually a job or a role. And therefore, I started to have students as a nurse when I was a registered nurse and, teach them. And because probably I was at some point wearing their same shoes, I was like trying to be, um, supportive mostly. And then when it came to the opportunity, I actually applied for the ACP role. So I was trying to do as much as I could to help the team and eventually got the job. And that's why essentially I became an educator.
Amazing. And I'm going to go on to the next question, actually. I want you just to give some examples for any students or newly registered nurses about what you do on a day-to-day basis. And I'm going to ask the others as well, but just one or two things that you do, and then we'll see what some of the others do as well.
So our duties, I think they really change based on where we work. So because at the moment I'm in an inpatient ward, most of the duties I carry out are about student placement, for example. So making sure they have shifts, they see the ward, they know the policies and everything that is going on, because they have to make sure they have the fit to practice and all, bureaucracy checks. After that, also another big part of our role is supporting international educated nurses. So, for example, support with the OSCE preparation and to pass the OSCE exam. Another big part of our role is also obviously making sure that all our staff is up to date with mandatory and statutory training. But not only that, we have to make also list of trainings and core skills that the nurses need to have when they work in a specific department. So we need to make sure that our target are reached every year. So every year we have that much trained nurse in that specific skill to to have that skill mix at all time and make sure the word is always safe. We do literally everything. We do also a study day, so where we train our own nurses about our specialties. So if you have, for example, mostly plastics, ENT, max fax, ophthalmology specialties, we do one just training day for each to develop the skills of our nurses in those specific areas. We also do budget managing, so we actually advertise courses as well and make sure that our nurses can decide which course is better suitable for them, and if they can actually be released to attend them. And it's much more than that, Carol. I will never finish if you let me
No,
on.
don't worry.
If you let me carry on.
Yeah, don't worry. I'll get some of the others to talk as well. So I was just thinking, Pratima, what about because it's not just about registered nurses, is it? You've got a lot of support workers, and we have a lot of career development for apprenticeships. So do you want to add anything else to what Maggie said? And then I'll see if Nana also, I don't know if Nana has anything else to add. So
yeah, I do exactly what Maggie said.
yeah.
Anything to add would be whatever Maggie said. We do that for the CS, healthcare assistants as well. We help them be practice educators, not practice educators. What do you call them? Nursing associates. And then if they want to be band fives, and many of them are internationally educated, very experienced nurses working as a CSW, so we help them in getting OSCEs as well done, and then we promote them as well to study more, get into linked jobs, provide them with extra educations and anything. One extra thing that we also do that Maggie probably forgot is that we do gap analysis. That way, when we find gaps, like we consistently have to be in conversation with managers so that to give the best care to our patients. And if there are any gaps, the managers will tell us from the Ulysses or many kinds of reports. And we have to do the bedside teaching so that those gaps are filled. So that is one of the important things. And we do that for healthcare assistants as well as the nurses.
Yeah. And it's a really, because I was a practice development nurse many years ago, but it's really rewarding doing the education and making a difference, isn't it? To see someone that might not understand something. So you get a lot of positive reinforcement from the people you're teaching, I would say as well.
Yeah.
So I'm just going to ask the same to Nana. If there's anything else you want to add, Nana.
Yeah. So I think from what Maggie and Pratima has mentioned, the role of a practice educator is more of a jack of all trade. We do virtually everything from all that they mentioned, training sessions, study days to managing budgets. We also help with staff development. And one thing I've realized is when you focus on staff development, when you focus on their continuous professional development, it results in excellent patient care. So we focus on that. And as a practice educator, you are also a role model. You would have to lead by example. As people say, you cannot pour from an empty cup. You would have to learn yourself so you can teach other people. So we do all that. And also, we are facilitators of the various shared decision making councils, which is very instrumental in running projects across the various hospitals. And yeah, I think all that they've mentioned, in addition to that, that is what we do as clinical practice educators.
Oh, that's amazing. And all three of you, thank you so much, because you've given us a lot of insight into training. You've got your documentation, compliance, but it's essentially, as Nana said, about patient care, isn't it? We're there to do it because we want to improve people's skills. We want to support staff, and often I think we're the people that people will come to sometimes, that'll, instead of maybe going straight to a manager maybe. So I think it's an essential role, and not all employers have these roles. Nana, while you're here, I'm going to go on to the next question, which is, what academic courses and professional qualifications have you completed that you think has helped you to become a clinical practice educator? And then I'll ask Maggie and Pratima.
Okay, so in my role as a clinical practice educator, and I think in every role as an educator, you would have to be in a position for continuous learning. Having bagged my BSc in 2015, then I came to England, I practiced. Then in 2021, I started doing my MRC in nursing studies. So I did that for a year, then I landed in this role. And part of the requirement for the role was to get a postgraduate in learning and teaching. So I did a postgraduate in learning and teaching in higher education for a year, which I've I'm yet to complete. I think by next month I should finish with that. And once I finish that, yeah.
Well
And once I
done.
finish that, I go back to do my masters. But it's not just doing masters, and it's about continuous learning. You should have that passion for learning because, as I said, you cannot pour from an empty cup. So that is what I've done when it comes to academic qualifications. When we talk about the various other CPD courses, well, those are numerous. I can't even mention. Yeah.
Yeah, no worries. So, I mean, what I would say, just as a bit of advice, is when you're looking at applying for these roles, some employers will have essential and desirable, obviously, and it might be that they don't have a teaching certificate on that job description and that personal specification, so you can apply for it.
Yeah.
I mean, in our trust, we have a lot of support for the education, you know, of all of you. So you don't be put off. I mean, what I would say, Nana, is you've got like the top qualifications, haven't you? Because you're looking at nearly completing your master's, and a postgraduate diploma in education means that you can teach in universities, and it's you know it's a lot of work, but you'll learn so much that'll enhance your teaching skills. But someone maybe that's a newly registered nurse or 2 or 3 years registered might start with a certificate in teaching, and then
Yeah.
you can top it up and see if teaching's for you maybe before you commit to that postgraduate diploma. Would
That's
you
true.
say? I mean, I
Yeah.
don't know if you, yeah.
Yeah, that is true. I mean, you don't have to just jump into, and for me, it was a bit of not finding the right information because I always thought, you know what, let me just do a master's. Let me do a master's. That was mine. That was just in my mind. Let me do a master's. And
Yeah.
when I came into this role, my manager has been very supportful, and she actually even guided me that, you know, you don't have to even do the full. You can do this, map them, and that has been helpful. So you don't have to say, oh, I need a master's to get into this role. No, you don't. All that
Yeah,
you need is the passion. All that
absolutely.
you need is that once you have the passion, you come into the role and there's so many support for you.
Yeah. And
Yeah.
but what you've done is this ongoing learning, which is amazing, Nana.
Yeah.
And you're going to be makes you a real role model for others as well. And what I would say as well, Nana, is you've been supported financially to do these courses.
True.
And one thing I'm always saying to students and newly registered nurses is if you put yourself out, you try and support others with teaching, you're more likely to get the funding from clinical practice from your employer or from Health Education England,
Yeah.
whichever funding route you're going to use. I've got a video on how to apply for funding. And the different routes to get into funding, but the fact that you were working towards that role will have helped you to have got the funding, because managers aren't just going to fund, I don't know, a degree in a master's in public health if you're not
Yeah.
working in public health. So you've done really well. So what I'm
Thank
going
you.
to do, I'm going to, and good luck finishing it all.
Thank you.
I know how hard it is. So Maggie, I'm going to ask the same question to you. What academic courses or qualifications have helped you? And I'll just try and spotlight you for everybody. And I'm going to reduce Nana in size now. There we go. It should work, hopefully. So what
So
courses have you done, Maggie?
So for me at the beginning, I finished all the, core, mandatory, statutory, and everything that it was necessary to work in the department where I was working. From there, then when I started that and decided that I like to be an educator, I found this course that was a short one, I think 2 days. I don't know if I can say the name of the provider, but it
No,
was a
don't.
2 days. It was a two
Yeah.
days course for teaching and training skills, which helped me a little bit. And then from there, I started to do more. So I did my care of deteriorating patient with another university, which was a module, a standalone module. Then I did my PG cert in higher education of 60 credit and decided then, while I already had 80 credit, to finish a master's. And therefore, I've done my leadership module just just recently completed, and then I'll start my research and my dissertation, and I will have hopefully an open award in nursing education by the end of it.
Amazing, yay! So, what you've given sort of some insight, actually, Maggie, into the fact, because you work in a really busy inpatient specialist surgical unit, and to feel confident to teach at a bedside or to do training days and study days for all the range of staff that you do, support workers up to, you know, registered nurses, you need to be competent. And like Nana said, it's being a role model. Now, you don't need to know everything. As he said, it's about always extending your learning. So if you don't know, you'll go and find out. But what you've really shown is also it's good to do specialist courses in your speciality or wherever you're working. So if you're working in oncology, doing an oncology course is going to help you towards that pathway potentially. So would you agree with that? Or
Yes, absolutely agree.
Yeah.
Yes, I think you have to have that if you want to teach then your colleagues as well. And you have to be competent. So you have to get everything signed off, ready to share your learnings.
I would also say though that sometimes you can go for posts. You'll have transferable skills, so potentially you could move now, Maggie, to an area where there's some surgery or deteriorating patients, or to a development role in A&E, for example. You're going to have transferable skills, aren't you, as well? So you don't be put off if you haven't got it. It's on that job description whether you need a specialist course or not. So I'm going to go to Pratima next, and let's just make you a little bit bigger on the screen. And what would you say, Pratima, for courses that have helped you?
Oh, for me, I became an educator after after 2 years of becoming a nurse. What helped me become a educator was my master's degree in nursing. Our manager really, well, she's an educator, so she really likes educating her staff, and she really loves staff who are already educated. So I already had a master's degree in nursing, so she appreciated that. And like Maggie said, you need to have done all the trainings, because like Nana also said, we have to be an example to our staffs, and to comply with the NHS England and to wherever you work, you need to have done certain amount of training. And if you want to be an exemplary nurse and to be an educator, to be a leader, you are a leader as an educator. So you need to have done the trainings yourself and then expect the trainings to be done by the others. So yeah, I had to do all the trainings. I had the master's degree. So that is how I got into education. And then after getting into education, I have also been offered to do the diploma in education by our team. So yeah.
Amazing. So thank you. And because you're probably the most junior out of the three, you know, that you've gone into education really early in your career, excuse me, which is really good. So I'm going to ask Maggie now, because in every role there's challenges. So Maggie, I'm going to spotlight you and just ask you maybe to give one challenge that you think, or something that you can highlight about the role. We've said a lot of positives, but in every role there's always some challenges. So do you want to?
Yes, so I think one of the challenge I can talk about for my own experience is standardized practice. For some reason, when you are practicing in a highly specialistic area, it's difficult to have a standardized practice. So I have everyone to do the same thing because it's backed up by the same research knowledge whatsoever. And sometimes, you know, when there's so many people involved in patient care, it's difficult to have them all on the same page, essentially. So that's a bit challenging sometimes. However, with the help of the team and the head of the department, like our consultants are very nice, to be honest. We have very nice consultant. We make sure that we share the knowledge, up to date practice, and we share it with everyone, not only with our nurses and nursing associate or nursing assistant, but with the registrar, our SHOs, and the entire MDT, to make sure everyone is doing the same thing, essentially.
Brilliant. Because you're really part of that, the whole team. Everybody gets to know the educators, don't they?
Yeah.
So I'm going to ask Nana. I'm just going to spotlight you, Nana. And I do know one thing I was going to say was about, I don't know whether Nana wants to talk about it, but the balancing of, because all of you work clinically as well, don't you, sometimes? So somebody needs to sort of mention that out of the three of you. But Nana, what's your take on one challenge maybe in the role, one or two challenges?
I think what I would say is having the time to actually plan your training sessions. And that is by no means anybody's fault, but it's just where high pressures of staffing issues everywhere across the country. So you can have a perfectly planned study day. And on the day or maybe few days to it, all staff are called back clinically because they are needed on the ward. The patient comes first. So that is a major challenge for us as educators. You cannot just go and teach when nobody is there. You are teaching to develop the staff. If the staff are not present, there's nothing you can do. But then again, you cannot also pull them from clinical to come for training when there's nobody to cover. So that is a big challenge for me, having that balance between getting study days and also being able to manage all these clinic pressures.
Yeah, and looking at overcoming that, would you say that with the planning, often with education, I mean, when I used to do it in neuro, we would plan days when we knew there probably would be more staff on, and we wouldn't run it on a day where we knew clinics were really busy or we had lots of admissions. That we tended to run our neuro days on Wednesdays, for example. But what would you say that you used to overcome that?
So what we currently do, or what I currently do, is, as you mentioned, look at the schedule, look at how the business of the ward or the department, how it's been, and there are certain days that you can at least predict, have a bit of hint to say, okay, these days are a bit calm. Then you plan it on those days, and also plan in advance. If you're able to plan way ahead, and if you're able to book study days for your staff, then the management are a bit inclined to oblige by those study days.
Yeah.
Regardless, the patient
Yeah.
always comes first.
Absolutely.
Yeah.
So thank you for that. So I'm just going to ask Pratima the same question. Is there any sort of other challenges that you found in the role, Pratima?
Like you mentioned, we are called clinical practice educators because there are days we have to be clinical as well, especially when the ward is understaffed or there is a special case, and then the skill mix is not great. Then you might be pulled into numbers. So there will be days when you will be pulled into numbers, and so whatever you have scheduled throughout the day will not happen, and so it has to be pushed. However, like Nana said, patients always come first, and then whatever we have decided, they can always be done in the next day and stuff. And sometimes the other problem would be the enthusiasm and the staff. Sometimes the enthusiasm may not be as great or how we would like it to be. But as an educator, it is also our job to make it interesting, to intrigue the enthusiasm. So that has also been a task for me and my colleagues. So yeah, we are trying hard, but we're trying to make beautiful posters or scheduling appointments, like making it beforehand, making it like in Microsoft Teams or stuff like that, instead of just going and telling them, so that they can plan their day properly. So, and then also using the Ulysses and gap analysis and trying to um, to make the staffs understand what teaching we are doing, why we are doing, so that they can understand and pick it up. And I think people get more enthusiastic when they understand why we are telling them, or what we are teaching them, and why we're teaching them. So we're trying to find means to make teaching interesting, so that people would like to attend it. Yeah.
I mean, I think what you all three of you have shown is your commitment to education. You're really approachable, all of you, and I think it takes a certain person to be an educator as well. And you're all compassionate people. You're good role models, and I think that really comes across. And I'm going to ask you, Pratima, what top tip have you got? If you each leave us with one top tip, um, I mean, what you've shown is the diversity of the role as well, actually, because Pratima, you're talking about making posters. So it's actually I'm quite creative. And I think that's one of the reasons I sort of started my career in education as well. It gives you that creative outlet, doesn't it? And you can devise your teaching sessions and stuff as well. But I'm going to ask each of you, and I'll start with Pratima. Give us one top tip for anyone wanting to become a clinical nurse educator.
I have two. One is,
yeah, good. Yeah.
be empathetic. Never forget where you come from, how you were as a band 5 or as a CSW, and always have you teaching as a learner based teaching, like you would have a patient based care, instead of having, like, how can I explain it? Like, do the teaching according to learner's need, and so that, and how they like it to be taught. Like, not every learner is the same. Some people like to be taught differently, and some people don't. And it doesn't mean just because these people, our staff, are not in a classroom and they are not called students by name, doesn't mean that, so we need to teach them in a learner-based process how they like to be, so that way they can understand it, and our job will also be fulfilled, and patient, and then eventually there's patient safety.
Amazing. So, Maggie, I'm going to ask you the same question. A top tip for anyone wanting to become a clinical nurse educator. And just bear in mind, they might be a student or a newly registered nurse, if we do it from that angle.
Yeah, so first of all, a lot of patience. So a hunger for learning as well. So you have to learn as much as possible, and you have to have like that enthusiasm and motivation for learning, and that kind of life attitude that you never know everything about everyone or everything. So you always learn on a daily basis. Make that a point from which then you can start sharing with the others. So you have to like share with others as well.
Brilliant. So, Nana, I'm just going to spotlight you. Any other tips there?
Well, I think Pratima and Maggie, they've mentioned all. Just
Yes,
to add to that, you need to have respect for people. You should know that you're not the custodian of knowledge. You don't know it all. If you do not know, you just have to be upfront about it, learn, and then you teach people. And also, you have to be adaptable. As an educator, your days are never the same. You come on a day with everything planned, your task, and just in a second, everything could change because you are needed to cover here, you are needed to be clinical, everything changes. You are needed to cover a manager. So you have to be that adaptable so that when things changes, you are able to adjust to it. So yeah, I think those are my top tips for anybody who wants to be an educator.
amazing. So thank you so much. And obviously you've all given really good tips about education and your experiences as well. That will really help people. You're all at different stages really, and knowing about all the education. So anything else anyone wants to say before we finish? Because and I so appreciate it. I know the newly registered nurses and students will really appreciate your insights, or anyone registered a while that's thinking about education. Anything else anyone else wants to add before we finish?
I would just say just have fun. Come in and
Yeah,
enjoy the fun of it. Because if you see it as a task, it's going to be tedious. Have fun. Have fun learning and have fun teaching. Have fun with your learners, not students, your learners. You're learning with them. And that way you enjoy it. And yeah, that would be what I'll add to it.
Amazing. Anything else from anyone else? No.
Yeah,
No?
maybe
Okay.
be open-minded, Carol, because as
Yeah.
Nana said, everything can change. So if you have an open mind and you're adaptable and flexible,
Yeah.
it's easier.
Brilliant. Okay, well, thank you so much, all of you. Enjoy the rest of your evening. Okay,
Thank
so
you,
thank you.
Carol.
Bye.
Thank you for
Bye.
having us. Bye.